I do want to say that some of the sound quality suffers on this interview, and I apologize for that. I tried to do my best with it, but sometimes when you record and you're not getting a great connection, there's not a whole lot you can do about it. I thought it was good enough to air, though, versus redoing the interview. So I appreciate your understanding in that. To Hypnotize Me. This is Dr. Elizabeth Bonet, and this is the podcast about hypnosis, transformation, and healing. Today's topic is about dementia and Alzheimer's. It's a topic close to my heart because I had a mother who died of Alzheimer's in 2013. Eckhart Tolle talks about the dissolution of the self and how Alzheimer's and dementia, you can see that process happening. And he's so right. It's such a completely different frame for it than, oh my God, they're losing their minds and now what, right? That's a fear-based kind of paradigm versus it's a dissolution of the self. It's coming back to who they are at an essence. When I heard about Roger Moore's program, I was intrigued because I am in South Florida. There are a lot of elderly here. I do have some clients in my own practice that have recently been diagnosed with Alzheimer's and dementia. And we work on moving out of anxiety, living in the present, enjoying what is here. But of course, there's fears that come up about the memory and losing it and some of the obsessive thinking that goes on in terms of checking appointment books and scheduling. And am I going to forget something? And all of this stuff around it. So when I heard about Roger Moore's program that you can do hypnosis for dementia in terms of improving the quality of life, I was intrigued and wanted to interview him about it. So I hope you find this interview as informative as I did. Hi, Roger. Welcome to Hypnotize Me. I'm glad you're here today.
Oh, thank you, Elizabeth. It's great to be here with you.
So let's jump right in with the question that I ask all my guests is, what was your first experience with hypnosis?
My first contact or real interest in hypnosis was about 1968 when I was working in a drug crisis hotline all night. Crisis call-in center, suicide prevention, and we also, this is during the Vietnam War, and we also helped folks get out of the States and into Canada and did the underground thing. But, it was probably 2, 3 o'clock in the morning, and the phones weren't ringing, and there was nothing to do, and there was a book laying on the desk about hypnosis. And I picked it up and started reading, and I've been hooked ever since.
Wow. So that's a long time you've been practicing hypnosis.
Yeah, I've been in private practice for the last 20 years. I've been a counselor for over 40 years. Reading about it and studying about it for a long time now.
And I know now you do your private practice, so you offer hypnosis, and you also do some training programs for hypnotherapists. And that is actually how I discovered you. I'm in a Facebook group with you, and I looked at a couple of your training programs, found one of them really interesting. So let's jump into that topic. That topic is hypnosis for dementia and Alzheimer's.
Oh, yes.
So tell me how you discovered this, how it came up on your radar even.
It was probably about 18 or 19 years ago, actually it was about 19 years ago, that a man at the gym came up to me one day and said, "I'm desperate, I don't know what to do." He moved in with his mom who had Alzheimer's, and she was so agitated, and he said, "Can anything that you can do with hypnosis for her?" And I looked at him and kind of shocked and said, "I have no idea."
Right.
Because I didn't.
That's how most things start, right?
And I said, "I have not a clue." And then I said, "But you know what? I'd be happy to offer my time and see if there's something I could do." And we set up a time, and she was in bed in her house, and I went to her house, and in the room was this woman and her son and her daughter. She didn't recognize the two of them, and it seemed like she recognized me. She thought I was somebody else, and I just kind of went over and played along with her, and ended up holding her hand with my hand, and then my other hand just laid on her arm, and just started talking to her really softly, and started talking to her about taking some nice deep breaths and breathing deeply, and told her some story. I have no idea what anymore, took her on some journey, some metaphor, and probably did a beach or something. She fell asleep, actually, by the time I was done. It was a couple days later, I got a phone call from him going, "Oh my God, it's a miracle." I said, "What?" And he said, "She's been the most relaxed for the last 48 hours that she's been in the last 6 months."
Wow.
So that was my beginning. And I met with her a few more times before she passed. The son just went on and on and on and raved about how much it helped her. She was sleeping better. She just was having an overall better quality of life because she was less agitated. He said that she had more lucid moments as well. But the big thing was the fact that she just wasn't as agitated. She was more relaxed.
Mm-hmm. So at that point, did you begin to do this more and more, or was it a time period in there before?
Well, there was a time period in there, probably another year or two, before I had another request, and I said, sure, why not? And again, I volunteered, and it was someone else I knew, their father, and here in the island, and ended up going to the care center where he was at a couple times, and then he passed. And I got curious about just what research was out there.
Mm-hmm.
I think this was probably around 2008, I think. And I started looking at, was there research, and I came across Dan Nightingale's research out of England.
Mm-hmm.
And got all excited about that and started communicating with him. Dan has since moved to the United States, and I've done training with Dan and been to his trainings, as well as doing some online work with him and training with him.
Mm-hmm.
So Dan and I have become friends because of the work with dementia.
Wonderful. So can you tell the listeners, what does the research say about how hypnosis can help dementia and Alzheimer's?
The research talks about how improved quality of life, that people are calmer and more relaxed. They have less fear, less anxiety. There's some interesting data showing that they have better ADL skills, activities of daily living, and are just do better at teeth brushing and those types of activities. The problem with the study is it's one study; it's never been duplicated. And Dan Beggs is trying to find somebody that would please take this on and do another study. So far, nobody's done it. It's pretty interesting research.
Yes, it is. I've read this study as well and was quite surprised at it because I had actually not heard of it before. My mother died of Alzheimer's. So I know quite a bit about the disease and about dementia, and I actually took professional training around dementia, wanting to help her more. When I ran across the study, though, I was like, wow, this was not mentioned anywhere. It is quite an effect in terms of people with dementia do tend to get agitated. They have the sundowning that happens. Where the sun goes down and they get a little more agitated around those times of days. So when you're working with hypnosis with them, is this specifically like, okay, let's see if we can calm some of the nervous system down, have them do daily tasks of living, better, more comfortable. Are you also working on memory? Like, can they retain their memory? Like, what does it say about that? What
It,
is,
I'm that depends very much, at least from my perspective, on the client. I have a man that I'm working with right now at my Seattle office who is still driving and actually still working, but does have a diagnosis of Alzheimer's.
mm-hmm,
And he has his own business and is in the process of transitioning out. So he still goes to the office and has other people doing a lot of the work for him.
mm-hmm,
But he drives to my office in downtown Seattle. We're working on memory recall, memory enhancement, as well as doing a lot of work with his fear and creating hope, finding places in his life where he can be hopeful.
mm. How does that happen? I mean, obviously it's individual, right? But when you say creating hope, what do you mean? Because part of what happens when people get the diagnosis and for their family members is immediately this hopelessness that sets in.
Exactly.
Like, oh my God, like I am going to lose everything
Right.
is the feeling. So can you say a little bit more about how you create hope?
Well, he was very depressed the first time I met him, and because as you said, he was hopeless, and those were his words: is feeling very hopeless and very doomed, and so we started talking about what was right in his life, what was going well, and started talking about his kids and his business. He has one of his daughters that's has actually moved here to help him and to help and is taking over the business ultimately. He started getting excited about the possibilities for her and expansion of the business, and that's been kind of the biggest source of his hope is what he sees as the possibilities for her and her future and the possibilities for the business that he started from scratch and has built and the employees who become family to him. That's just made a huge difference in terms of his overall happiness.
Okay, so focusing more on legacy, like what is your legacy going to be and
Yes,
what kind of
yes,
legacy can you
yeah,
leave?
yeah. And, what I do when because I do a lot of work with folks with cancer, and I'm thinking of somebody that last Christmas got an emergency phone call to go to the cancer center and see this man, and got over there, and his prognosis was pretty damning. The doctors were telling him you have weeks, and there was this potential therapy that he could do that was pretty awful, and the just total hopelessness on his part.
Mm-hmm.
And by the way, the man's is alive today and doing very well. But anyway, he when I walked in, he was sitting there looking at a picture of a little girl on a cell phone, and he's just going on and on about hopelessness. As we were talking, and finally I said, "So, when I came in, I saw a picture of a little girl on your phone." I asked who that is, and he sat up straight and he beamed and kind of giggled, and that was his granddaughter.
Mm-hmm.
And I got him talking about his granddaughter, and he got color in his face. He laughed, he giggled, he'd tell me stories, talk about holding her and cuddling her. So what do you want for her and her life and her future?
Mm-hmm.
Suddenly he had hope. It was all in her. That point in time, and he assumed, and we all assumed he had days or weeks left to live. He wasn't focused on his prognosis, but he found a place to look for hope.
Okay, and the hope was his granddaughter
and the
and
future
spending time with her and her future.
Not even so much, he knew his time with her was going to be limited,
Okay.
but what he wanted for her and her future, and
Okay.
the type of person he wanted her to be. And he was really focused on being loving and kind. It wasn't about her being successful. That was all nice. And she could be educated if she wanted to be. But it was really all about her being loving and kind.
I know you work some too with end of life planning. Is that part of that process? Is okay, you have the prognosis. Now, how do we handle the end of your life with a way that feels better?
Again, that's depending on the client. I just had a woman pass a couple weeks ago, and first she was driving about 40 miles to my office, and then that got to be too much in the last couple months, and so we were doing online sessions a couple times actually from her hospital, and but she was at home when she passed. And for her, it was just finding peace, uh, moving through, talking about any fears, love, talking about her life. And with her, it was a lot. We focused a lot on joy. She would talk about when she was in her 20s, being in San Diego and roller skating um, down at Coronado Beach. And I've actually done that myself. And again, she'd just come alive. And her whole beingness would change, and she'd laugh and giggle. And we talked about memorizing that joy, not memorizing the anger, hurt, fear, pain of cancer and death and dying. It's about living in that place of joy. And one of our last sessions, she talked about how wonderful it is to be able to die joyfully.
Wow.
And that she just goes roller skating. And that's what she hoped her last thought was that she was on the beach roller skating.
Oh, beautiful. Like a thought of joy.
Yes. Yeah.
Wonderful. So I'm going to jump back to the dementia. And I am interested about you working with the memory enhancement. I know that's a big issue for people, particularly when they're often first diagnosed, because they still do have a lot of their memory. And then the fear is there, obviously, that they're going to lose it over time. But are you using like the same type of protocols that most hypnotherapists use in terms of better recall and studying techniques and better memory kind of techniques?
I do more probably what most hypnotherapists do on mindfulness, and being in the moment. Because often what I hear from people that happens is that when they can't remember somebody's name or can't remember why they walked into the kitchen, and of course I remind them that they've done that all their life, just like the rest of us.
Yeah. Right. It's like I did last night.
Yeah. Or I did this morning. Yeah. Okay, why am I here?
Yes.
That in those moments, rather than getting agitated and scared and upset and getting stressed and getting out of body and creating it worse, getting the adrenaline pumping, being chased by the tiger, and that I teach them a couple of different real quick, simple stress reduction techniques. One is just simply putting thumb and forefinger together and taking a deep breath into the nose and letting it out through the mouth as they release their thumb and forefinger. Another one is I give them a recording called Orange Blossom, which is a free 27-minute relaxation MP3 on my website. If you go to hypnosishealthinfo.com, on the homepage, right in the center of the page, can't miss it. It's there.
Wonderful.
It's had over 100,000 downloads.
Wow.
And it's used around the world in medical settings and surgery centers, and people go to sleep with it. But the goal is that after 2 weeks of listening to that, that anytime they feel the least bit of stress, tension, anxiety, they simply say or think Orange Blossom and feel a wave of relaxation flow over them.
So it's training the brain and the body to move into that state with the cue word.
That's correct.
Mm.
The other one that I teach them, I call Roger's Wiggle. I have no idea where I learned it. Just one day it kind of came out. But I have them wiggle their toes, wiggle their butt, and take a deep breath in through your nose and let it out through their mouth. That's all it is a wiggle.
So it gets them into their body, like more present.
It gets them back in their body, gets them mindful.
Versus running off in their mind of, this is awful and I can't remember. And is this part of dementia or is this just normal walking into the kitchen?
Exactly. Because when you're in that mindfulness place, when you're aware of breath, feet in the floor, then it's like, okay, why did I come into the kitchen? And if I don't remember now, well, as soon as I leave, it'll probably come to me. But have them be in that peaceful place of being centered in their body versus being chased by the tiger and stressed out, which only inhibits memory recall.
Yes. I have a patient I'm working with where the more we can bring down her anxiety, the better, really.
Exactly.
The better she does, the better she functions, the better she is able to even check her appointment book or say, I just checked it. I don't need to right now, because sometimes they get obsessed with checking the appointment book and have I checked it? And, that gets into an anxiety process. So when we bring down her anxiety, pretty much everything goes better for her.
Exactly. Right. Absolutely. I teach self-hypnosis, and it's a form of what Jerry Hine used to teach, the light switch self-hypnosis, and how to give themselves suggestions and take themselves deeply relaxed. And depending on how advanced the dementia is, some people do very well with suggestions, and for other folks, it's just simply, going to the beach or to the mountaintop or to their back deck or wherever their happy place is. And if I can even get them to do that several times a day for a minute or two or a few minutes, that has just a tremendous benefit for them, is the feedback that I get from them and from their family members.
Yes, I imagine. Yeah. And then that affects the rest of their day, like whenever they do it.
When I work with folks with dementia, in addition to the client, I try to get either family members included to the sessions or caregivers included, so that the family member, that is living with them, or the caregiver that's in there, they know and understand the tools and can remind them of the tools in between our sessions or throughout the day, and can support them and being mindful, support them in being relaxed, support them in, do you want to listen to Orange Blossom now, to help them along that way. So I found it just very beneficial, with the client's permissions, to say, I would suggest you ask your son or daughter to attend the sessions with you, or your caregiver to attend with you. And
yes.
Most people are very happy to do that.
Absolutely. And I found the same thing. It's almost impossible, I think, to treat someone with Alzheimer's and dementia without having a family member involved or a caregiver involved.
Right. But the only time I actually haven't is like the gentleman I was talking about who still drives to my office.
Yes. Yeah. He's still high functioning and still running his company and doing things like that. Yeah.
Yes. Yeah.
I guess I was thinking more of when they reach a certain level, it's like someone has to be there too.
Exactly.
And not even necessarily the whole session, but part of the session, and working with them and how they can help their loved one or the person they're caring for.
I have a woman from London that I'm working with, and her daughter lives with her, and the daughter sets up the computer for the online sessions, and the two of them are sitting side by side throughout the entire session.
Mm, that's wonderful. So her daughter's getting benefit as well, even.
Exactly. Yeah. Yeah.
Yeah. And do they report that? Like, I'm using that too, and it's helping me, the orange blossom or the techniques or whatever that is.
Oh, very much. And I hear that a lot from the caregivers,
Mm-hmm.
and because giving care to anybody is almost built-in guarantee there's going to be stress.
Yeah.
And then there's the heartache of when mom doesn't remember your name,
Mm-hmm.
or when mom, doesn't remember that she's already had breakfast and is asking when she's going to eat again.
Mm-hmm.
That's stressful. It's heartbreaking.
Yes, it can become very stressful. The constant attention that's necessary.
Right.
Mm-hmm.
Right.
And heartbreaking as well. There's a
Yes.
grief process that goes on, like losing the person before they die,
Right.
essentially.
Yes.
Mm-hmm.
Yeah.
So, can you talk a little bit about your training programs that you've run for hypnotherapists or hypnotists, either one, wanting to offer this in their community, because it's such a valuable service. I mean, I'm in Florida, South Florida, which is the
Uh-huh.
elderly population here is very, very high. And I imagine how helpful it is for other people to know too that they could offer this to family members and to people struggling with dementia and Alzheimer's.
I only offer advanced healthcare support training, and
Okay.
it's advanced courses. People who are already hypnotherapists, or people
Mm-hmm.
who often I'll get doctors and dentists, or mental health counselors, psychologists, psychiatrists,
Mm-hmm.
marriage family therapists that attend my trainings who have no prior hypnosis training or minimal hypnosis training.
Mm-hmm.
And but that's the type of courses that I offer. And so the dementia classes that I taught with Dr. Dan Nightingale, if you go to rogermooreinstitute.com, you'll find them there.
Mm-hmm.
And also, if you look in the Facebook group, Dementia Therapy Specialists, which is Dr. Dan's
Oh,
Facebook page.
that's a great resource.
Yeah, oh, it is. It's excellent. You'll find his trainings as well.
Gotcha. So the ones listed that you listed, I'll put in the show notes for people to be able to access, so that if they're interested in getting training in this
Right.
area, they can do that.
Having said that, I have two or three people right now that either did Dr. Dan's training or did our joint training that I am coaching. So
Mm.
I do offer them, individual support and coach them that way.
Oh, great.
But it's so
That's
but that's
wonderful,
yeah,
because this
yeah.
is such a specialized area. It can be heartbreaking for the therapist as well
Oh,
to
absolutely.
to
Yeah.
watch someone go through the progression of
Right.
dementia and Alzheimer's. So that's
And
wonderful that you can provide support and coaching about, okay,
right,
what's the next step here, and what's going on, and really knowing it intimately inside and
right.
out.
Yes, there's those professional boundaries, but when we're working with somebody that's in end of life, whether it's Alzheimer's or cancer or some other disease,
Mm-hmm.
um, there's a bond that forms.
Mm-hmm, definitely.
And, every time one of my clients passes, I grieve, I mourn. And it's a process of learning how to allow that grief and that mourning. And it's important to acknowledge that so that you can move on. And when I got the phone call a couple of weeks ago when this other woman passed, within 2 minutes, I was sitting down in front of another client. And
Mm-hmm.
it's like, okay, Roger, this is what's going on, and now you got to pull it together for the next person. But also then spent private time later on that day and the days following of doing my own grieving process. And,
Yes.
it's important for therapists who are doing this type of work to be okay with doing that.
Yes, definitely. And you're right. Sometimes the requirement is you have someone right then, right there that you need to attend to and put your attention on, but you need to come back later to address some of your own feelings about what
Exactly.
happened. Hmm.
Exactly.
An important part of self-care and
Yeah.
staying connected to
Right.
your own heart as a therapist.
Yeah. Yeah.
Yeah, which helps you connect to patients. Yeah.
Absolutely.
Yes. Well, we have come to the end of our time. I want to thank you very much for being here. I really appreciate it.
Well, thank you, Elizabeth. This has just been a real honor and a joy. I appreciate this.
It's raining while I record this portion of the podcast, so you may hear that in the background. Listening to Roger talk about his clients and how he works with them, I could just truly feel and hear the kindness and love and compassion that he has for them, working not just with dementia and Alzheimer's, but also end of life questions and hopefulness and lifting someone out of depression and having them enjoy the last years of their life. And sometimes if someone's sick, then that becomes difficult due to the pain body, right? Living in the pain body. But his ability to say, okay, let's transcend that some and see if we can find some joy and happiness here really struck me as such a gift and act of kindness and service to people. I do work with dementia and Alzheimer's in my practice in South Florida. It's not the focus of my practice, but I do find hypnosis helpful for people coming in for that and processing the anxiety and sometimes the depression that comes up too. I'm an anxiety specialist, so I think I tend to see more of the anxious people that come in and say, what do I do here? This is so painful. Anxiety and rumination and not being able to stop thoughts is so painful. It really is. Keep that in mind in case you know someone who needs that or you need that. The caregivers often need support. I wouldn't even say often. I would say always need support. I saw my sister be the primary caretaker for my mother who was living in Texas. I was living in Florida and I would fly in to see her. And I know what a strain it put on her. And it was hard to see her suffer as well. So often in families, it becomes a two-part goal, right? Not just taking care of the person who is at the end of their life, but also the caregiver of that person, if that person is family. Even if they're not, being compassionate for whoever the caregiver is for your loved one. Just a reminder before I go that episode 55 is a free hypnosis that you can download for someone going in for surgery for cancer. It's specifically written for that. If you have a loved one that is dealing with that, perhaps they're near the end of their life, perhaps they're not, please make sure that you go and download that and give that to them. It's completely free. You can get it on the podcast, episode 55, or on the website, drlizhypnosis.com/episode 55. That's DRLIZ hypnosis.com/episode 55. All right, people. Peace. If you like this episode, do me a favor and rate, review, and subscribe on whatever player you like, or even better, tell a friend so that more and more people learn about hypnosis and how it can be helpful for them. If you want to know more about me, head over to drlizhypnosis.com. That's DRLIZ hypnosis.com. You can see the downloads and see if there's one that's helpful for your life. Or you could also join the newsletter and get a couple of free files as well as lots of good content. I've written a newsletter for well over 10 years. Go ahead and subscribe and join the rest of the world. All right, people, have a wonderful week.